Well, compared to the rest of the country, Vancouver Island and the West Coast might enjoy an image of clean living, an active outdoor lifestyle, generally better health and eating habits. But is that reality or perception? The Vancouver Island Health Authority says people who live on the island, in fact, have a higher rate of premature death. Aaron Glazier has the story.
Problems we're looking at are avoidable, and we certainly should be doing better than we are.
Strong words from Vancouver Island Health Authority's Chief Medical Officer, Dr. Richard Stanwick. His annual report card on our health found that while we are more physically active and eat better than most, there are still bad habits that are preventing us from living longer.
The simplest one would be to continue to work on our smoking picture, and as the report shows, while we're doing better than the rest of Canada, the island isn't doing as well as the rest of British Columbia.
Increased alcohol consumption, suicide rates, and motor vehicle crashes also contribute to the island's higher than average premature mortality rate. But most alarming is the increasing trend in chronic diseases.
We've got obesity and overweight rates that are starting to approach 50%, and the concern is the day may come where a parent who is in their 70s or 80s are in bed with a chronic disease, heart disease, type 2 diabetes, and basically in the bed next to them is their offspring who is suffering from the same condition in their 40s and 50s.
And fitting in the suggested 30 minutes of running on the treadmill or sweating up a storm on the bike, a priority.
A lot of people find if they don't squeeze it in before work or at lunch, when they go home, there's just so many things to do. So a lot of people are coming in and doing like a 45-minute spin or a 50-minute yoga class and just getting there done.
Another concern in the capital is the high proportion of seniors. In 2010, just over 18% of the VIHA population was over 65, well ahead of the Canadian average at 13.9%. And despite some limitation that may come with age, the important thing is to keep going.
I've got very severe osteoarthritis in my spine, so I'm all held together with Velcro. I have a head brace too that I use, and it's so important that you keep active.
The importance of prevention is also a key message when it comes to following Canada's food guide. A balanced diet can help prevent chronic disease starting at birth.
We really look right from the beginning of the lifespan, so trying to encourage those healthy habits right from birth, and that will lead to healthy teens, healthy adults, healthy seniors.
Stanwick hopes the report gets you and your family talking about health and looking at making small changes in daily living activities and habits that will keep you alive longer down the road. In Victoria, Aaron Glazier, A News.